At Health Innovation Manchester, we've taken an approach to accelerate a number of projects in partnership with industry. We are bringing together the best of the creative sector and the immersive technologies with the best of the healthcare sector and innovation. We're hoping just to hear new things that we haven't considered. The real benefit of today is that it's the start of a process where those ideas will be prototyped and will be further refined.
If you look around the room, the people that I've spoken to today, it's a real mix. You've got creativity, you've got people that are actually in the NHS, you've got doctors here, you've got clinicians, you've actually got patients here as well. And actually you need that in any sort of environment where you're trying to actually foster change.
Events like today are very unusual. There's a tendency for everybody to be siloed. So having all of those people in one room trying to answer the same problem, I think is quite unusual and quite special.
It's perspective, it's amplification, it's communication, that leads to innovation. And I think the sum total of what you have in the room today is greater than the sum of its individual parts.
The way we approach health needs to change. The clinicians are important because of course they're the ones doing the work. The creatives are important because they're the one putting the message of the clinicians out there. But the most important are the patients because they are the ones who need it the most. So bringing all those three groups in one room is very important. And within the conversations that we were having as well, we spoke a lot on community, reaching the communities the right way.
The key is that it's driven from a patient perspective in order for it to be relevant and add real value as opposed to just technology for technology's sake.
My name's Eric Lowndes, I'm 72 years old. When I was 60 I had a stroke. Because I had a stroke, it sort of got me involved with Health Innovation Manchester. It was fantastic today because we did have the clinicians, we had innovators, we had the general public, and we all contributed to what has been a very interesting day.
We know that there are lots of people living with ill health and we've been trying to deal with it for a long, long time. So what I think is really interesting is, okay, let's try some different approaches, let's bring in some different perspectives. And this is a great example of a city coming together, and more ideas will come from this.